Welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. On our program today, we're going to be talking about congestive heart failure. And our guest for our program today is board-certified interventional cardiologist, Bashar Samman. Dr. Samman, welcome back to Today's Health.
Barb, it's always been a pleasure being here with you.
Well, thank you. And I'm really looking forward to this program because it impacts so many people. So let's start with the beginning. What is heart failure?
Well, let's talk about the heart to start with. The heart is a muscle, and the main purpose of that muscle is to pump. Heart failure is because that pump, for a reason or another, is not able to function the way it's supposed to. It's either too weak, so it's not pumping blood out, or it's too stiff and not able to relax to accept blood in it. And as a consequence of that, the pressures inside the heart start to rise, and that reflects on the body. It reflects on the lung, on the legs, and that's what we call heart failure. We can have heart failure affecting the left side of the heart, what we call left heart failure. We can have heart failure affecting the right heart failure. And in a lot of us, we have what we call congestive heart failure. It's the right and the left. The whole heart is affected. And that's the most common heart failure pattern that we see usually.
Who's at risk to develop heart failure?
Well, heart failure risk is quite a long list if you want to think about it. But there's people that are definitely at a much higher risk. If we can start with weakness of the muscle of the heart. Then we have to go back and think what will make the muscle weaker. On the top of our list, people that suffers a heart attack. When the muscle suffers a heart attack, part of the muscle is no longer working. So it's a scar, is no longer able to squeeze. The larger the scar you have, the weaker the muscle is going to be, and the pump is going to be weaker. Some of us, we have weakness in the muscle of the heart, not related to blockages, and that could be related to an inflammation of the muscle, to an infection of the muscle, and some of us, we have what we call idiopathic cardiomyopathy, which means basically when we say idiopathic, meaning we don't know why, it just happens, the muscle weakens. Other causes of weakness of the muscle of the heart are related to the valves. The valves are a device between the chambers of the heart. They're one-way valve. They let the blood go from the top to the bottom, for example, and the blood goes out another way. That valve should open depending on the cycle of the heart and close. But in some of us, that valve either doesn't open completely or doesn't close completely. So we can have heart failure related to what we call valvular dysfunction, meaning the valves are not working the right way. The mitral valve or the aortic valve are the most common one. If we're looking in people that have heart failure because of stiffness of the muscle of the heart, meaning the muscle is able to squeeze, but it cannot relax. And if the muscle doesn't relax, it doesn't accept the blood coming into it, so the pressures are high in the heart. We see that in people that have high blood pressure for a very long time. We see people that have disease of the muscle itself that make it stiff. So as you see, heart failure is a very wide range of disease. Some of us have more than one problem at the same time. People can have high blood pressure, heart attack, and valve problem at the same time, and they all affects the muscle of the heart, and that will increase our risk of heart failure.
Well, heart failure is such a dramatic word, and it sounds like it should be a dramatic word. Does it happen all at once, or does it happen over time?
No, it can be suddenly, or it could be gradual problem. When we think about heart failure, we have different classification. Some of us may have heard New York Heart Association 1, 2, and 3, and 4, which classified people in heart failure. The way we classify them, one is I have some symptoms, but very mild. I can do most of the stuff I want to do. I do okay. To the extreme number 4, which I can barely move without having symptoms. But we have another class that we call a class A, or stage A. It's people at risk for heart failure, but they don't have it yet. And that's a group that is very important to pay attention to. That's the people that can have the risk of heart failure, but are not there yet. Now, can it happen suddenly? If I suffered a heart attack suddenly, a large heart attack, heart failure is going to occur right away. In people that have high blood pressure is going to take years for it to affect me. So it may be 5, 10, 15, 20 years, and the symptoms are gradual. And symptoms of heart failure are not always the same. What do I mean by that? We can get ill with heart failure getting worse, and what we call exacerbation of heart failure. Then we get better with treatment, so we come back to a certain stage. So it can be an on-off things, and that's a good news somehow, because we have treatment to make people feel better at a certain time, and we always hope that when we get better, we can stay better, and that's something always a concern. Can we deteriorate again or not?
You talked a little bit about the symptoms. What are they?
Well, the symptoms, the most common thing that we complain of is shortness of breath. And that can be, as I said, with class 1 to 4, can be a wide range. I can say, well, I get short of breath when I run up the stairs. Mm-hmm. I get short of breath when I walk fast. And then the worse my heart failure gets, then I start to get short of breath just walking to my bedroom. Then I get short of breath even in bed. I can start to have swelling in the legs, because the reason is because, as you remember, we said the pressure start to rise, and that backs off the fluid in the legs. So people start to have swelling, what we call edema. Some of us cannot sleep flat, because when we lay down, the pressure in the lungs is so high, we get short of breath. So we use 2 or 3 pillows, and some people say, well, I can't even lay in bed. I sleep sitting up in a recliner chair, to be able to sleep. Some of us wake up in the middle of the night gasping for air. So heart failure symptoms, shortness of breath is the most common thing. And the swelling can be in the legs, can be in the belly, can be in the lungs. Fluid in the lungs can be, all reflective of heart failure. Those are more common. People sometimes complain of feeling more tired. I'm more fatigued, I'm not able to do things, I get tired easily, worse than usual. That can be a sign of heart failure as well.
We're going to take a break, and then we're going to come back and talk about how do you make this diagnosis.
Thank you.